Yeah, thank you. So my role at TCT is a mental health development worker. So working with Transforming Communities Together as part of the Anglican Diocese of Lichfield. So that's a bit of a mouthful, but really what it means is working with churches across Staffordshire, Shropshire and the Black Country to help to equip them to become more confident in working with people to enhance their mental health. So working with them in their mental health journey, really. Also recognising what churches are already doing in their parishes, in their area. So they may well already be doing mental health work or pastoral care, but may not call it that, may not recognise it, but are already building relationships with people, and creating hospitable and safe spaces.
Indeed, as I say, it's a key time as well for this particular issue. I think you were telling me earlier that the role was lined up pre-COVID, but actually now, as we're coming out of COVID, it's got a really vital role to play.
Yeah, it really is, and that's really being recognised. I think mental health was becoming sort of higher on people's agenda. There's been a lot more sort of talk about it in the public space. Obviously now people have their own sort of social media platforms and things like that where they're able to be a voice. People are able to sort of self-publish memoirs and autobiographies. We've also seen a bit of a rise of high-profile people talking about their mental health journeys. So that's people within sports and singers, some people within the royal family. So that's really helped, I think, to break down stigma. I think there's still a long way to go, but I think from the beginning of the pandemic, really, there was a sense of, certainly I felt, as well as this being a sort of medical emergency, really, it was also going to be a mental health journey.
No, absolutely, and I was going to say we've covered it a lot actually, and some of the key aspects is asking the tough questions at times. I remember Gray from Samaritans has been on talking to me. She said, "Oh, you got to ask the brave questions. If somebody says, 'Oh, I don't want to be here,' what does that mean? Does that mean I don't want to be in this situation, or is it actually I don't want to be alive? Be brave and ask the tough questions, which is very hard to do, but it can help people, can't it?
It really can, and I think. It's about asking those questions, isn't it? And just really feeling confident to have conversations with people and ask those questions, and to listen well, to not think you have to fix everything. I know that can be a real initial sort of sensation of, oh my goodness, this is a situation, I need to fix that. But I think it's about being real, being honest with yourself, being real with people, listening really well. Knowing what questions to ask, and what also, what things perhaps not to say that are perhaps less tactful, and just knowing where to go next, really. So that might be the GP is always a really good first port of call if people are struggling. There's lots of organisations and resources out there to support people, as you've mentioned, the Samaritans. At Transforming Communities Together, we offer training for people around some basic mental health training and mental health support. It's about caring for yourself as well, to be able to be compassionate, be really present with people, and be sort of what's sometimes called sort of a non-anxious presence, and just to be alongside people,
right.
And to have those conversations.
And and not avoiding people as well, because that can often happen if people are struggling, if they've lost someone. And someone the other day said to me, what we need to do is change the word, the question. We all say, "How are you?" "Oh, how are you?" And it's a greeting. It doesn't mean anything. And if you put the word "today" on there, "How are you today?" that makes a big difference, doesn't it?
I think that's true. Yeah.
And what are the kind of questions that you use that are openers for you?
Yes, that's a good one. How are you today? How's your day going? I think that's helpful, because, as you say, if somebody says, "Oh yeah, how are you doing?" It's really easy just to say, "Oh yeah, fine." But actually, because I think sometimes we don't know ourselves how we're doing. But if asking, "Oh yeah, how's your day going?" it kind of roots you, doesn't it? To be able to think, "Yeah, how is my day going?" And it's a bit more specific. Is it going better than yesterday, for example? And you can link it to something tangible. Say to somebody, "Oh yeah, actually I'm preparing for this meeting, and it's quite stressful actually." And it just helps you to root yourself in something that a global pandemic. It's there's specific risks and anxieties, isn't there? But it's also a very generically anxiety-inducing concept.
And you were saying a key part of your role is supporting churches to help people as well. Perhaps, even to recognise some of the support they've been given to people over many years. And we've now labelled this kind of support as social prescribing, haven't we? But actually, it's been going on for years in terms of just supporting people, putting a safe environment around people. So perhaps part of your role might be actually saying, actually, you're doing a great job already.
Exactly that. Faith institutions, faith groups, the government has recognised, for a number of years now, just how much, that sort of social capital, if you like, how much work that faith groups are doing. And as you say, it's sometimes just recognising that and recognising actually churches are often at the heart of their community. They're often, buildings that people recognise and use, perhaps for other things like Weight Watchers or whatever it might be. And so churches are already placed in the centre of their communities. They're really equipped. They know their communities. They know people. They know individuals. They're often already offering coffee mornings or different kinds of support. So it's recognising that and naming that, and perhaps also saying, well, what's the next step in engaging with communities? Is what's going on now. So, for example, some of those places are reopening. One of the projects within TCT is Places of Welcome. So we worked with some of those hosts to just think about what are going to be some of the practicalities around reopening spaces. What are some of the things that people are going to be bringing, the experiences they've had over the last few months, recognising what's already been done really well, and perhaps looking at what needs to change or adapt, and helping to move forward with that is helpful, I think.